Dear donor, Sub-Saharan African countries face the highest under 5 mortality rate compared to the rest of the world, with 78 deaths per 1,000 births. Many of these deaths are preventable. The leading cause of death for children under the age of 5 are pneumonia, diarrhea, and malaria. LivingGoods is a charity focused on providing healthcare to Sub-Saharan Africa, with the main countries of interest being Kenya, Uganda, and Myanmar. LivingGoods travels door to door and offers basic health counseling as well as household goods. The main goal of LivingGoods is to allow mothers to have safe deliveries, lower child mortality, and prevent easily treatable diseases. The health providers educate families in the local community about better health practices involving pregnancy, child and newborn care, medicine, everyday life choices, and proper nutrition. They also provide resources to people such as bed nets, pregnancy kits, and water filters. LivingGoods originated in Uganda in 2007 and since then has expanded to Kenya and Myanmar in 2015. According to Peter Senior's The Life You Can Save charity list, LivingGoods is considered a top-ranked charity.
LivingGoods is a charity not only focused on saving lives but also improving lives. This charity has been proven trustworthy. It's a charity that uses data-driven performance management, which are government partners who are selected only if they demonstrate the motivation and devotion to deliver high-quality services to communities in need. The CHWs participating in the charity's work go through an intense process of tests, interviews, and training to assure that they are highly qualified and prepared to provide help. This charity also sets distinct targets to ensure that the services are effectively supervised. These supervisors then have to go and make regular in-person visits to the communities. LivingGoods also partners with skilled researchers that conduct randomized controlled trials to accurately pinpoint which methods proved effective. These participants are assigned to one of two groups. One group receives the treatment, which is LivingGoods Aid, and the other group receives no treatment. The studies compares the two groups to see if there was an impact on the communities, and if there was, how much of an impact there was. They evaluate the data and research with the government partners as well to maximize the effect of health services and budgets to their communities.
According to the charitynavigator.org, LivingGoods scored a 91.45% and a 4 out of 4 stars on overall score and rating. LivingGoods is a highly cost-effective charity, meaning that there is a larger impact per donated than other charities. This charity also has a good standout transparency. This means that the program is very open and sharing with the public. Some charities are discreet and appear deceitful, while this charity is honest and open. LivingGoods scored an 89% on their accountability and transparency score. Among high ratings, they've been recognized with numerous awards. Some of these awards include the Audacious Project in 2018, which is a project that was launched that year that empowers entrepreneurs and nonprofits to take on the world's biggest challenges. Another award is the Skoll Award for Social Entrepreneurship. This gives out any awardee or received a $1.5 million investment or a core support grant from Skoll over 3 years to scale their work and increase their impact. The Life You Can Save recommended charity also gave this award, focused on something recommending charities that help with the world healthcare crisis concerned with premature death and livelihood. Also, the Giveable Standout Charity Award focuses on recommending charities that are extremely cost-effective and are evidence-backed.
LivingGoods research data shows a program in Uganda had an effect in reducing the number of unnecessary deaths. After 3 years, the mortality rate for children under the age of 5 went down by 27% at an estimated cost of about $68 per life saved. There is strong evidence that supports this program and its ability to treat diseases like malaria and pneumonia. LivingGoods products like mosquito nets and medication are proven effective to improve health. LivingGoods also improves access to healthcare and quality of healthcare in the areas where it works. In 2018, LivingGoods has helped over 7 million people by providing them access to healthcare. They focus on areas where they can have the biggest impact at the lowest cost.
There is some research that suggests that products supplied by LivingGoods is not efficient enough to prove impactful because most of those supplies, such as mosquito nets, can be provided by other charities and organizations. However, essential medicines and supplies are consistently in stock with LivingGoods compared to other charities, which explains their inability to deliver different types of supplies.
There is a financial incentive to sell more treatments, so sometimes it is possible for the CHPs to overdiagnose people. The program is aware of this problem and is taking action to resolve it by implementing a system to reduce the likelihood of this occurring. Because this is a fairly new charity, they are still learning how they can be most efficient. It's a learning process, but you can trust that they are cost effective.
Have more go for your dollar and donate to LivingGoods, where you're not only saving lives, but also improving the quality of life to those in need. Sincerely, Gabby.
Alexandra.
Holiday.